Hello, it's Dr. Rhonda Johnson. Today is Monday, August 22nd, 2022. And today I am talking about cancer preventable risk factors. Now, there was such an important article published on August 20th in the British Medical Journal Lancet, which found that half of all cancer deaths globally could be attributable to 10 preventable risk factors. Now, I'll go through them. The top three are smoking, alcohol use, and obesity. And then the next preventable risk factors are unsafe sex, high fasting plasma glucose, air pollution, occupational exposure to asbestos, a diet low in whole grains, a diet low in milk, diets low in fruits, and exposure to secondhand smoke. So let's flush this out a little bit. We all know that tobacco is the number one risk factor for lung cancer, and that's the number one cancer of men and women globally. So by stopping smoking, you help reduce your risk of cancer of the lung, bronchus, and trachea. Now, alcohol use, many people don't realize that alcohol is a risk factor for cancer of the oral cavity, the esophagus, the colorectal, liver, and female breast cancer. So cutting back and eliminating your alcohol intake will reduce your risk of those cancers. Now, obesity is linked as a risk factor for cancers of the stomach, the esophagus, colorectal, biliary tract system, pancreas, uterus, ovaries, and kidneys. Now, unsafe sex can, mostly because it's associated with certain infections, such as HPV, which can cause cervical cancer and cancer of the throat and anus. Hepatitis B and C, which can be transmitted sexually. They're associated with liver cancer. We know HIV can be associated with unsafe sex, and it can be associated with AIDS-related cancers such as Kaposi sarcoma, non-Hodgkin's lymphoma, and cervical cancer. Now, back to the high fasting glucose. People with type 2 diabetes, the most common form of diabetes, are twice as likely to develop liver or pancreatic cancer, and they run a higher risk than normal of developing colon cancer, bladder cancer, and breast cancer. Now, air pollution is linked to lung cancer. Occupational exposure to asbestos can be a risk factor for mesothelioma cancer, mesothelioma. And then a diet that's low in whole grains, because whole grains intake can lower your risk of colorectal cancer, stomach cancer, pancreatic cancer, and cancer of the esophagus. Now, milk. Some studies have linked low milk intake as a risk factor for colon cancer. And then it makes sense that fruits and vegetables and secondhand smoke can be linked to a lower risk of cancer. So you want to have diets that are rich in fruits, and certainly secondhand smoke is bad for you. So how can we increase our whole grain intake? Well, use that whole wheat instead of white bread, white rice. Eat whole grain cereal like oatmeal or bran flakes. And then try whole grains such as quinoa or barley, or either, do some research on your own if you want to increase your intake of whole grains. So that's my message today. I believe most of us can modify some of our risk for cancer. These are preventable. It's never too late to take these steps to reduce the risk of cancer. And as always, talk to your doctor about what is right for you. Take care.